When we think about risk to ourselves, I think about, am I going to be close to somebody who might be infectious? And that range of closeness is about 6 feet, but frankly, in the same room is when my alarm bells start to go off, right? Do I have to go into a room where there may be a patient that's infectious to me? So there's getting close to someone who's infectious. And that ties closely to the issue of, well, hopefully they're wearing a mask for source control, but we'll come back to that later. The second thing is, am I in a closed space or do I have lots of air exchange? If I'm in a healthy space with lots of good air exchange, that reduces my personal risk a lot. On the other hand, as we've seen with situations like exercise classes that were poorly ventilated, or there was a bus ride in China where the ventilation system wasn't working and almost the entire bus got infected. So that environmental piece, is the air handling right, is the second thing. In some situations, the best thing is just to be outside. For example, for a testing system or even triage in some cases. That's if you have the luxury of not being in a very cold, frosty place where this time of year it's harder to do. So, is the air in the environment that I'm going into the best that it can be? Those two things come first. The next thing is stuff like equipment and procedures. So, under procedures, am I about to do something that is going to put me at risk for greater exposure to aerosols? Am I assisting with an induced sputum? Am I working on a bronchoscopy or not? Are the patients and others wearing source control masks? Because that alone reduces the risk to me tremendously. And then last but not least, my own protective equipment. What am I going to be doing? And how do I need to protect myself?